My name is Sarah Marshall. I have 4 daughters, and I live in Minnesota. I hold a master's degree in social work, and as Dwayne said, I work as a medical case manager for women and children living with HIV. My daughter Phoebe was accepted and evaluated by the Undiagnosed Diseases Network, and I've served on UDN Peer since 2018 and been co-chair since 2022. Phoebe was accepted into the Undiagnosed Diseases Network in 2017, as was said, and the UDN, for those that don't know, is a research study that is funded by the NIH, and its purpose is to bring together clinical and research experts from across the United States to solve the most challenging medical mysteries using advanced technologies. Being accepted into this study changed the trajectory of her life. And you may ask, how did it change her trajectory? Simply because she got a diagnosis. Because without a diagnosis, there is no treatment. And without treatment, there is no hope for a better quality of life. So I'm going to begin this presentation with the diagnosis part of her story. A de novo missense variant of GDF11 was identified by the research arm of the UDN. The diagnosis opened the door to precision medicine that has improved her quality of life and allowed her to live as a typical teenager. In this paper, identifying loss of function variants of GDF11, 6 cases were described with variable but overlapping clinical symptoms. The clinical symptoms involved intellectual disability, cognitive delay, seizures, neurological abnormalities, visual disorders, hearing disorders, craniofacial anomalies, palate anomalies, vertebral anomalies, scoliosis, toe abnormalities, connective tissue abnormalities, and cardiac abnormalities. Of these 13 clinical symptoms, Phoebe had 9. She is programmed 6 in this study. Now let me start at the beginning of her story. This is Phoebe, born healthy in 2008, youngest of 4 sisters, all of whom to this day are very close to each other. Oh, they really are. Phoebe's diagnostic odyssey began at 6 months old with a bout of pneumonia. Subsequent to that, she began having respiratory infections about every 30 days that required antibiotics. At 2.5 was her first hospitalization. Joint pain and skin rashes started at age 2, vision problems and headaches at age 5, liver inflammation at age 6, fatigue, weakness, abdominal adhesions, bone and spine anomalies identified at age 7, encephalopathy at age 12, followed by depression and anxiety. And in total, she's had over 20 surgeries and multiple hospitalizations from ages 2 to 13. It was always something. These are some photos from some of her early hospitalizations. Here, she's 6 years old. Here is a photo of a diagnostic test that was done on her retina. The bright spots along the blood vessels show where fluid is leaking out. The tests were done because she complained of seeing black spots in her field of vision for weeks on end. She was 5. Some skin manifestations that have occurred over time. Here along her entire shin looked like a bruise, but wasn't. Doctors thought this might be scleroderma, but a skin biopsy proved negative. I was advised by her physicians to take photos when something new happened. Here, she woke one morning with redness and swelling around her eyes. Her skin can display these lesions when exposed to the sun. After testing, her dermatologist has rendered this a porphyria-like manifestation. This is a photo of scar tissue that forms between her cecum and her intestine, always causing pain. Her surgeon lyses the adhesions, as seen in the picture on the right, and her pain is remedied. For this, she has had 9 surgeries since 2015 and 2021. This is a photo of spinal fusion to fuse L5S1, where she was having pain for over a year. We decided to go ahead with spinal fusion after extensive imaging was done, and interventional radiology was able to confirm the source of her pain, and no other options to ameliorate her pain and improve her quality of life proved effective. Making this decision was not done lightly. She was 11. Weeks later, a post-surgical infection landed her in the hospital for an additional 3 weeks. Hypogammaglobulinemia, retinal vasculitis, liver inflammation, arthalgia, recurring abdominal adhesions, myasthenia gravis, Bertolotti syndrome and scoliosis, encephalitis, and depression and anxiety. Over time, Phoebe has received what I call siloed diagnoses. Siloed because, siloed because most of them are rare or ultra-rare in and of themselves, but none came together to offer a unifying diagnosis. Specialist seen. I'm not going to read this list because that's beside the point. Look at how long it is. And it doesn't include all the emergency doctors and inpatient hospitalists that we've seen over the years. What is the financial cost of a list like this? And what does it do to a childhood to have to be seen, poked, and prodded by so many people? The cost is incalculable. Here is our real-life costs for our family. Prior to Phoebe's diagnosis, her insurance claims per year ranged between $700,000 and $1.2 million per year. I was unable to join the workforce for years because of the frequency of her illnesses, and from kindergarten until 7th grade, she missed an average of 65 or so days of school. Since her diagnosis, her insurance claims have nearly halved of what they were. I've been able to hold full-time employment, and her days missed are about a third of what they once were. Had Phoebe been diagnosed 10 years or even 5 years earlier, this would have saved the insurance company millions and would have allowed me to re-enter the workforce and given back more of Phoebe's childhood to her. Sorry, let me go back. Currently, she receives monthly infusions for myasthenia gravis, and based on her genetic diagnosis, Precision Medicine was able to recommend an already FDA-approved medication that thus far has ended the cycle of her recurring adhesions and therefore eliminated the need for frequent surgeries. Additionally, she takes daily medication for myasthenia gravis, depression, and anxiety. Her treatment has vastly improved her quality of life, and today she engages in very typical high school activities. Examples of all the normalcy because she receives treatment. This summer, she got her driver's permit. She went to camp with her sister. This is her first day of sophomore year. And my hope is that this paper will help physicians, insurance companies, policy, and lawmakers recognize the imperative need for a timely diagnosis as a means for cost reduction over time, decreased mortality rates, and improved quality of life. Newborn screening has the ability to catch so many diagnoses so early. And beyond newborn screening, I hope this paper highlights the importance of collaboration among specialists, demonstrates the need for genetic testing, and helps insurance companies imagine the savings that can be had if they were to fund research-based genomic sequencing and other advanced technologies that would make way for both diagnosis and treatment for ultra-rare patients like Phoebe. Thank you.